Good afternoon. Welcome to the daily briefing at the St. Clair County EMA office, where I'm joined by Chairman Mark Kern. And welcome back, Sam Behrman from the Health Department. Sam,
Thank you.
Glad to have you back.
Thank you.
And belated happy birthday, even though we wished it to
Thank
you
you very much.
yesterday. And another year older and a lot wiser on that.
Well, that's what we'll go with.
Yes.
So as of today, 30,548 St. Clair County residents have been tested for COVID-19, which is an increase of 807 from the day prior, with 3,433 positive test results, which is an increase of 76 from yesterday, and that does include both males and females from under the age of 10 up to their 80s. And for today, our county positivity rate is at 9.4%. Currently, we are at 27,078 negative test results, with 37 results that are still pending. We do have some sad news to announce today. We are reporting one additional death, which does bring our total for the county to 150. That individual was a female in her 70s who did have underlying health conditions, and as always, our condolences go out to her family. For those who have completed their IDPH required 14-day quarantine period, we are at 2,343. For state totals, we are at 2,470,723 that have been tested, with 169,883 positive test results, which is an increase of 1,426 from yesterday. For deaths, the state is reporting 7,397, which is an increase of 12 from yesterday. For hospitalization rates, and these are for hospitals that are in St. Clair County, currently 50 patients are admitted due to COVID-related reasons. None of those patients are currently on ventilators, but with our number of patients that are hospitalized, that is the highest hospitalization rate that we have had since June 11th. So it's been quite a while since we've been that high. For our congregate living facilities that are in outbreak status, which is res staff and or residents that are either COVID positive or who have COVID-like symptoms, we are just going to do the facilities that have any changes. Autumn Meadows of Cahokia has 7 cases and no deaths, and Brea of Cahokia has 35 cases and 3 deaths. And I will turn it over to Chairman Kern for his update.
Thanks, Sam. And in the congregate living facilities, that's an increase of 1 case in each
facility, yes.
And we're still seeing, the 40 and under bracket. About half of the cases today, half of the new cases were people 40 and under.
Yeah, and that's the age range that we've been seeing, and I think that we're going to continue to see for a little while.
So they're the ones we need to get the message out.
Yes.
Okay, we'll move into the zip code report on this Saturday. Today, we've got in 62059, we remain at 10. 62201, we go up by 3 to 171. 62203, we go up by 4 to 134. 62204 goes up by 3 to 102. 62205 goes up by 1 to 131. 62206 goes up by 6 to 303. 62207 goes up by 4 to 192. 62208 goes up by 11 to 213. 62220 went up by 8 today to 275. 62221 went up by 3 to 293. 62223 went up by 4 to 142. 62225 stayed the same at 13. 62226 went up by 5 to 341. 62232 went up by 2 to 71. In 62239 we went up by 1 today to 32. In 62240 we went up by 1 to 12. In 62243 we remained the same at 20. 62254 went up by 1 to 112. 62255 went up by 1 to 10. 62257 remains the same at 19. 62258 went up by 2 to 44. 62260 went up by 3 to 37. 62264 went up by 1 to 65. 62269 went up by 7 today to 215, and 62285 remains the same at 28. So a lot of changes in a lot of zip codes. Herb, the regional positivity is now up to 7.1%. So 8% is that level when the state talks about moving back. And so we started out, we're going up a 0.1 every day. So we need to make sure that that goes the other way.
Yes, we don't want to continue to go up. We've been preaching that, talking about it, and that's what I want to talk about today. I had a little brief discussion with one of our followers today, talking about how county government and county leaders haven't been doing anything, and I had to explain to the gentleman that he must be new to the page, because for approximately 135, 136 days now, we have been beating the message home to everybody. And it seems like when that June 26th date came along and we went into phase 4, everybody thought the light switch, not everybody, I shouldn't say that, but quite a few people just thought it was all over with and we didn't have to use the mask and social distancing. And you're right, it's going in the wrong way, 7.1, and that it was posted as of today. So we keep telling you. Another person sent us and I thought was a good example of you go into the store, they got signs on the window says no shoes, no shirt, no service. You get on the airplane, you have to wear a seat belt or they don't take off. If OSHA comes into a business and tells you you got to do this, you got to do that, we do that. But boy, if we ask somebody to wear a mask for at the most an hour or two out of the day to help protect yourself and others, we're supposedly taking away their rights and their liberties.
And it's about protecting others.
Yes.
That's the thing. It not only protects other people from your germs, but in case you would contract it, you're now going to be going to the hospital, and there are people who are putting their lives in danger. The people that transport you to the hospital, should that need to happen, the doctors, the nurses, the police, the fire, anybody that's involved, they're all out there on the front line because you failed to wear a mask and protect yourself.
Well, and what I keep stressing, the physicians that we've had come on here, the medical experts, there hasn't been a one of them that says to mask, that they don't say that it's 100% foolproof. They've all said the same thing. It's a precaution, just as you said, not only for the person you're around or yourself, but those medical experts have all said the same thing over and over. The administrators from the hospitals, our EMS personnel that we've had in, the law enforcement people, everyone, the mayors that came in from the communities. Speaking of that, there was an article in the BND today quoting the local mayors, quoting you in there. So everybody is doing their share. The political leaders, as this gentleman said, that nobody's doing anything. There's a lot of people, every one of you who follow this page and is sharing it and telling your families and friends to practice the social distancing, wash your hands, wear your mask. You are a part of that solution. The ones who aren't doing that, I'm to the point where I don't know if we're ever going to convince you to do that, so I really don't care if you continue to comment on the page. You're free to do that. You're free to voice your concern. But as I told a young lady just before I came in this afternoon, our job here at EMA is to take care of our citizens of the county, especially during the pandemic. So we're going to continue to do what our medical experts are telling us here locally, because after all, they're the ones that's going to be taking care of you if you get sick here in the hospitals locally. And I don't want to go in there and say, well, I didn't think you were right, I didn't wear a mask, so because she's going to be standing there with a mask on, so we're going to continue to do our job. But tomorrow we'll be back here with our Sunday question and answers. The link will be up earlier if you want to put your questions on there. We'll try to answer as many of them as possible tomorrow afternoon. Next week we got a schedule of all 5 days. We're going to have different school districts in. We're trying to get as many as the districts done. We're getting a lot of comments from parents wanting to know what school districts are doing, and we had 3 this past week, and we're going to continue that. So we appreciate everybody taking the time Saturday. 76 new cases, 1 new death here in the county. One's too many, and we're up to 150 here. That means 150 individuals that don't have the option or the choice anymore to wear a mask or practice social distancing. And I would strongly encourage you not to become one of those statistics. So we'll be back momentarily with Daisy and Cindy to translate this into our Spanish communities, and then we'll be back here tomorrow afternoon at 3:30.